Hello, and welcome to This is USG, a video podcast by the universities at Shady Grove. 9 universities, 1 campus, great results. I'm Ann Kademian, Executive Director of USG. Today, it is my pleasure to welcome the current president of the Montgomery County Council, Gabe Albornoz. The son of immigrant parents, Gabe is a lifelong resident of Montgomery County who attended Montgomery County Public Schools and then went on to earn a BA in Communication from the University of Maryland and his MBA from Johns Hopkins University. He spent several years as Montgomery County's Director of the Department of Recreation before running for and winning a seat as an at-large council member in 2018. In addition to serving as this year's council president, he is chair of the council's Health and Human Services Committee. Councilmember Albornoz, welcome to This is USG.
It's such a privilege to be on, Ann. It's good to be with you especially.
Thank you so much. I want to start off with a bit of your personal journey. You, as a leader in the county, you have spent a lot of time focusing on public health and on issues of equity, and you were right in the center of the COVID storm, and in terms of trying to support the county and the residents of the county. Public service is what you do in a wonderful and passionate way. I wonder if you could tell us a little bit about your own personal journey. How did you find your way to public service? What was your career path that brought you to where you are now?
Well, thank you so much for that question. So it's been an interesting path because when I was in high school and college, I wasn't exactly sure what I wanted to do with my professional career. I thought at one point I wanted to be a physical therapist, but nobody told me that involved a lot of science. And so that didn't quite work out the way that I thought it would. But it was actually an experience in college while I was at the University of Maryland doing a study abroad program that in retrospect planted the seeds that set me on a course to be interested in public service because it was such a profound experience. I really volunteered for an organization called Casa Alianza, which was an NGO in Mexico City that worked with homeless and runaway kids. And one of my first assignments was to shadow a social worker who was charged with finding the mother of a 16-year-old girl that was dying of AIDS and who had about a 9-month-old baby daughter who was HIV positive. And growing up in Montgomery County and in Bethesda, going to Walt Whitman, I didn't fully appreciate or understand the bubble that I lived in. And although I grew up in a working class, middle class family, my parents gave me everything I ever wanted and more. And that experience, though, was profound because it took us several weeks to track down the mother who lived in a shantytown on the outskirts of Mexico City. And of course, these homes didn't have addresses and there was a lot of mobility. And we finally tracked her down. And I will never forget meeting her, explaining to her that we had found her daughter, that she had not seen in a couple of years, didn't know whether or not she was alive. She was so happy that she was, and then had to explain to her what AIDS was and what an HIV positive test likely meant for her granddaughter that she had never yet even met. And so that was an overwhelming experience. And this was, of course, in the midst of the AIDS epidemic. And when I got back, I just thought to myself, wow, the people that I worked with at Casa Alianza were angels. They inspired me. I enjoyed being around them. I enjoyed working with them. And I was just really inspired by that work. So when I got back to DC and I graduated from college, I went to go work for Children's National Hospital, then called Medical Center, and did community outreach work for them, fundraising work for them. But serendipitously, 20 years later, who would have known that this skill set would have come and helped and so handy? But at the time, DC had just passed legislation to require students to receive immunizations before they could report to school. They were one of the first jurisdictions in the country to do that. Well, not surprisingly, thousands, and I mean thousands of kids who didn't have their vaccinations, often from Ward 7 and 8, weren't able to go to school. So you solved one challenge, but created a whole other challenge. And the DCPS wasn't sure what to do. So to their credit, they turned to Children's National and said, please help. And I ended up helping to facilitate and manage the citywide immunization campaign. And I did it as a young, recently removed from college student. But it taught me the importance of public-private partnerships. That often these projects need to be community-driven. That government can only go so far, and that often doesn't provide things in a culturally appropriate way. So that partnership and alliance was very powerful. And from there, I went to go work for the Latin American Youth Center, doing youth development work. And I met one of the most consequential professional mentors of my life, and that was a woman named Lori Kaplan, who is still with us, not in the past tense. But Lori helped, although she didn't found the Latin American Youth Center, she became their executive director within 5 years of its development, and took it from a small organization in the basement of a church to becoming one of the most nationally and internationally recognized youth development organizations around. And the organization was very similar to Casa Alianza in Mexico City. And so it had the same DNA. And I just got such energy from that work. And in those travels, I helped open up their offices in Montgomery and Prince George's County. And that's where I got to know people on the Ike Leggett transition team. And they were looking for a director of the rec department that had experience with youth development. And that got me that job. So I was in the nonprofit side, and then I went to go work in the government side for 12 years. And it was those collective experiences that taught me what's possible, that taught me no matter what circumstance a youth or family find themselves in, with a caring adult and with the right support, they can get out of almost any circumstance. And it taught me the importance of resiliency, and that it reinforced government has such an important role to play, can set the table, but it can't get us over the goal line. We need to make sure that we partner and align with our university systems as well, to make sure that we have the workforce that's ready to roll up their sleeves and meet the needs of our community. And I'll just end my opening comments with this. I love public service. I just get a lot of energy from it. It doesn't really feel like work, frankly. And just waking up knowing that what I do is in some way making a difference, both at the micro and macro level, is like the cherry on top. So it's been a unique journey. I think I'm probably about maybe approaching halfway through my professional career, halftime. And I'm excited about what the third and fourth quarters are going to look like.
Wow, what a story. I'm so struck by how every single experience has built on the next experience, and how you've connected the dots across all of your experiential opportunities to be where you are today. It's really impressive. I think, we don't always collect what we learn and carry it forward, but you clearly have done that in your career, and that's to the benefit of all of us who live here in Montgomery County. So thank you for that. Thank you so much. Let's talk a little bit about the pandemic. And, as chair of the Health and Human Services Committee, you were right in the center of this effort to try to bring relief and protection and safety and healthcare to the residents across the county, and especially residents who didn't have access to all of the testing, or the masks, or who had to work, who didn't have a choice to work from home behind a Zoom camera. And I wonder if you could tell us a little bit about how, 2 years now, it's not quite in the rear view window, but it's we are coming, at least we're seeing some light at the end of the tunnel here. How do you think we're doing, and what stands out for you in the Montgomery County response to the pandemic?
Well, thanks for that question. So I still remember I was at a community forum hosted by Action in Montgomery, and the county executive was sitting next to me. This was in March, I think, of 2 years ago. And he looked at his phone and he turned to me and he said, "We've gotten our first positive COVID case in Montgomery County, confirmed." And who would have imagined what the road that we would have taken, and the twists and turns within that road, where all of this happened, unfortunately, under the previous presidential administration, who made our work more hard than it needed to be. And it was like flying blind. for such a long period of time. All of us, and including I'm sure you as well, in whatever sector we were in, were faced with this unimaginable challenges and questions that we had to pose to ourselves. Notwithstanding the fact that we all had family members and loved ones that we were concerned about, that we were disconnected from. We missed milestones. We, of course, had more than 2,000 people die here in Montgomery County, countless more lives impacted. And the disproportionate impact on our Black and Brown community was frankly immoral. And so, although the public health infrastructure that we had prior to the pandemic, I would put up against any other jurisdiction across the country in terms of its scope and breadth and depth of work that includes our primary care coalition, which had already years prior to the pandemic had formed this incredible time and space for our health clinics to share information and collaborate and leverage resources. Our hospitals were part of something called Nexus Montgomery, which had been developed on its own, again, years before the pandemic, where our 6 hospitals don't view themselves as competition, but truly complementary of each other and support each other. And of course, we are right in the backyard of our federal government with NIH right here in Montgomery County, and some of the most impressive and important researchers and scientists and health leaders in the country all live right in our community. So we had this abundance of resources and infrastructure. But despite all of that, it still felt herky-jerky. It still felt exhausting. And at various times, just like the blind leading the blind. So there were points of despair. I remember vividly getting phone calls from constituents breaking down crying, and me breaking down crying with them because I just didn't know how to help. And it became immensely frustrating. But through all of that, the county picked itself up and was able to build upon systems in a way that was really meaningful. So how did we do that? In a few ways. One was we partnered with our minority health initiatives and program. One of them with the Latino Health Initiative, and Nancy Navarro and I worked on this together, along with the Latino Health Initiative, established Por Nuestra Salud y Bienestar. There was a point over an 8-week period in which over 78% of the positive test cases were in the Latino community. And every one of those data points meant a family was losing a loved one. And Nancy and I had been pounding the table saying, you've got to provide information in a culturally competent way. You have to meet the community where it is. You can't just simply translate documents and expect that to have the box checked. Why aren't we leveraging faith partners? Why aren't we leveraging health providers that are already working within the community? And we kept getting responses of it's coming, we're working on it. And to be fair, it was a crazy time. But we said, you know what, this isn't working. And so Nancy and I convened a meeting of community leaders over Zoom. And over the course of 72 hours, a plan was formed that turned into this initiative that went from Latinos being the highest positive test cases to being among the lowest with the highest vaccination rates of any demographic, including our Caucasian population. We then transferred that model to other minority communities, and we were able to launch the Black Physicians Network, which was extraordinary. And our Asian American Health Initiative worked tirelessly on the mental health issues that were disproportionately impacting the Asian community. So out of this despair and chaos came the development of a system that I actually have a lot of confidence in moving forward, and that we can build off of and address some of the myriad of needs and the fallout from the pandemic. And that fallout includes things like we're struggling with recruitment and retention in key frontline positions, nurses, social workers, case managers, behavioral health specialists, and that's going to have to be a priority. And we also are still dealing with the devastating mental health effects of the pandemic, which have left scars on all of us, but especially our children and youth. So those are areas, though, through this system building that I have more confidence we can address than I did at various points during the pandemics. So how are we doing? Better than I thought we would. But we still have a long way to go.
Yeah, I really appreciate the focus on system building that is cross government, nonprofit, communities, volunteers, everyone to make that system work. Montgomery County has, in contrast to the rest of the country, Montgomery County has done exceptionally well in addressing, in coming out of the pandemic and addressing the challenges. And I know there's always work to do, but it sounds like we have some good systems and collaborations in place to continue to grow and evolve as well. So Montgomery County is a pretty creative place, thanks to leaders like yourself. And when it comes to problem solving and finding ways to move forward with a very progressive, equity-centered vision. And I was particularly struck by the news about the sports commission that you have championed. I myself was an athlete in college and high school, and the chance to compete and to run at Michigan State University was game changing for me. It paid for college and gave me opportunities that I could not have imagined. So I am thrilled to see what you are doing with the Sports Commission, and how this can be, a real game changer for other young women and for all communities across Montgomery County. I'm wondering if you could tell me a little bit about your motivation for this. I think you're an athlete yourself. I've seen pictures of you in basketball uniforms and soccer uniforms, and
Yeah.
so I'm sure athletics have been, an important part of your life as well. Talk to us a little bit about the inspiration for this initiative and what you hope to accomplish with it.
Well, first, I didn't know you were a student athlete. That's a cool tidbit. I'm gonna share that with others. Just add another checklist of the cool things I think about you. Um, so my dad put a poster of Pele in my crib. So I was indoctrinated into sports in the youngest possible age, and my dad coached me in soccer through MSI, all growing up, and that provided a special bond between my dad and I that I still hold so dear. And my greatest friendships all came from playing sports, and sports really centered me in a way that helped organize my life, to have something to look forward to have a goal to strive for, the camaraderie that it came with on the soccer team I was on. Of the 14 players on the team, there were over 8 different countries represented in my old youth MSI soccer team. Kids from Zaire, kids from Cambodia, kids from Venezuela, kids from Czechoslovakia. And so it was such a powerful experience in my development in every way imaginable. And I was fortunate enough to go on and play soccer in college. I was a goalie. And it helped with mind, body, and soul. And I still play, I still coach my kids. But I've also recognized that not every child, not every youth in our county has that same opportunity. And as the director of the recreation department, I saw firsthand, and now with 4 kids myself who are going through the youth soccer and youth development and youth sports world out there, it's a tough world to navigate. And we have a missing middle in sports participation in Montgomery County. And it is disproportionately impacting our girls and young women. And it's disproportionately impacting communities of color. And so I commissioned a report through the Office of Legislative Oversight prior to the pandemic that looked at youth sports participation in the county. And it confirmed what we suspected was true. There are entire zip codes where kids are not actively playing sports. And the reasons are clear. Number one, oftentimes mom and dad, who are working oftentimes more than just one job, don't have time to volunteer and coach. And so there isn't that infrastructure. Number two, the cost of participation in these various leagues, and let's face it, sports has become a pretty significant economic driver in business, is really challenging for people to be able to access. And we're also missing recreational opportunities. We go from zero to select and elite and club and travel with very little in between. And not every child is going to get a scholarship to college. Not every child is going to be on a select program, but every child benefits from having the opportunity to go out and play with their friends. So where there are holes in the system, we need to fill them. And I do think government plays a role in that regard. So I've proposed legislation, and we unanimously passed on the council a new commission, a body that will be charged with looking at the big picture, with literally trying to level the playing field, making recommendations to the council on capital projects, filling operational goals where they may exist, and really empowering the recreation department to expand their efforts to create more recreation leagues. In the 70s and early 80s, the rec department provided many different sports options, but those have been absorbed by some folks who are doing a great job. And this is not an either or, I want to make clear as well. There's absolutely an important role to play for these highly competitive, well-organized sports associations. I personally benefited from them, but I think that we need more options, and that's what the Sports Commission is going to be about.
Yeah, no, that's great. I just, the opportunity for everyone to play, run, jump, swim is wonderful. It is an important part of a healthy overall life. So thank you for that initiative and your work there. Talking about leveling the playing field, we at USG are very focused we always have been for our 20 years of existence, and especially into our new strategic plan. We're very focused on creating educational opportunities for everyone, and really looking holistically at the educational experience from K through 12 into community college, into baccalaureate opportunities, into graduate opportunities, but lifelong learning, and trying to create pathways that give students choices, options, empowering students, students who may not be able to go away for 4 years to a college, but who might need to work along the way, take care of families along the way, finance their own education along the way. Maybe they're first in their family to go to college and there's no infrastructure there for navigating this whole effort. So we want to think holistically about this educational experience, and we want to do it with all of our partners. We want to do it with MCPS and with Montgomery College and other community colleges that we work with, and with all of our 9 academic partners here at Shady Grove, with businesses, with the county, with everyone. And I think that you have to approach it as an ecosystem to really think holistically about the student experience and really start with the student experience. Can you talk a little bit about how you envision education in the county? And we've got this kind of big vision that we're focused on, but it's going to take a lot of the exact kind of partnerships that you've been describing, public and private and nonprofit, and everyone working together to build this. Talk a little bit about how you see education and the educational ecosystem in Montgomery County, maybe its strengths and where we can really focus on some of the weaknesses. And the role of USG in that effort as well.
Well, first, let me just say that I have such respect for USG, and what it has evolved into is nothing short of extraordinary. I think that you all provide a key to unlock the full potential of our community and this county. And I see it, I recognize it, and you can draw a straight line between that work and economic development and opportunities for all. So I think it's terribly exciting, and I'm very excited that you all are here. And the education ecosystem starts at the earliest ages. The council recently passed legislation to create this new early childhood and education entity that will help ensure that we enhance both the quality and quantity of instruction and of childcare. And we also need to make sure that there's a workforce in place that can be there to take on and assume these positions. And I think that is one role that USG can play, is ensuring that we are supporting this ecosystem of workers, but in addition, entrepreneurs, people who want to start their own childcare businesses and opportunities for families, so that we have a more diverse set of options. Because that is one of the biggest barriers right now to economic development. So many women had to leave their professions and careers through the pandemic and have not come back. And it's true of entire family units. And so it's preventing people from being able to work in the way they'd like to, both to support their families financially, but also to take advantage of their talents. And Lord knows we need more talented people right now to address some really complex issues. So I think it starts there. And then within our public education system, I do think we need to be more creative in the manner in which we teach curriculums. I think there should be a greater emphasis on team building, on doing things in teams. I think we need to look closely at some of the curriculums that haven't changed as much since I was in school 30 years ago and are not preparing kids for a 21st century economy that we are seeing today. We need to ask tough questions, and we need to balance both, and this is challenging, but we need to balance both ensuring fair and equitable practices while maintaining a high standard, and a significant educational rigor that pushes us to excel. When I was at Walt Whitman High School, which is one of the top 20 high schools in the country and the top high school in the state of Maryland, pretty consistently, it was an ultra competitive environment. I mean, success was the floor at Whitman, and excellence was the expectation. And it was a very challenging environment. But Whitman did a great job of providing a really strong support system in place for students, both organically and directly. And there was a path forward for whatever direction you wanted to take. And that raised the bar for me and opened my eyes to what was possible. Every student should have that same option and opportunity. And we have to do a better job of, I think, also career development and exploration, because it can be overwhelming to think about what we want to do with our lives and the different tracks that we want to take. And I think we should be more intentional about enhancing programs like Summer Rise to directly connect high school students to meaningful and gainful internship opportunities in professional settings. I mentioned my experience in wanting to be a physical therapist. It just sounded like something cool to do. And, I had had an injury in high school, and my physical therapist was like a life coach in a lot of ways. But I didn't have any idea the framework that was necessary to become a physical therapist until I started down that path and ended up having to change course, which was okay. But I think had I known, or somebody had mentored me in advance, maybe I would have chosen a different path earlier on that was more interesting to me and more consistent with my strengths. So, I think career exploration is important. And I think we just, and USG is doing this, we need to make higher education more accessible, literally more accessible by just the level of expense, but also the flexibility for students to be able to continue to work full time. I worked full time while I was in college, undergrad. I worked at a Mexican restaurant, which ended up becoming a manager. That's what helped pay for college. My parents helped out tremendously as well. And then in grad school, I went at night, for 3 years, and it was like the best decision I ever made, besides marrying my wife. And so those are, options and opportunities that need to be there. And the last thing I'll say, there's so many things we could talk about. We need more mentors. We need, both professional and academic mentors that can help shepherd us through oftentimes some bumps in the road, which are going to happen, but I can always point to people that lifted me up when I was down, and I'm trying to do that for other people now.
Yeah, you do that for a lot of people, Gabe. I agree. I think every student should have a mentor, an opportunity to be mentored. Every student should have a chance to be career ready, to know what that is, and to have all the tools at their fingertips to be career ready, including teamwork. Every student should have a chance to, experience the job, up front, and get a sense of what that's like. And hopefully every student should have a meaningful career opportunity upon graduation, whatever level they're at. I think that that's something we can do more intentionally and more collaboratively together. And so I hope that we have a lot of good work ahead of us, but centering the student experience will be important. I'm gonna wrap this up by asking you one more question, Gabe, about something that really stands out in your career, just as you've been reflecting on students and on our youth. you also have spent a lot of time in your career focusing on the needs of the elderly as well. And so you really have focused on, our most vulnerable populations. And I'm wondering if you could talk a little bit about why that's important for you and, the importance of focusing our public policy efforts, not only on our youth, but also on our elderly as well. I think that will kind of bring us, I think, to a point of your deeper belief system as a public leader.
Well, I'll start on a personal level. So my grandparents lived with us until they passed away. My grandmother had Alzheimer's, my grandfather had Parkinson's, and my mom was the primary caretaker for both of them, and it almost killed her. And seeing the decline, the cognitive decline in my grandmother to this day, and she passed away almost 30 years ago, is still so hard to process. And as a late teen, seeing this incredibly dynamic and brilliant woman go through what she had to go through, and then my mom seeing her mom deteriorate in that way, just left a really deep impact on me on many different levels. And I've always been taught that you have to take care of your elders, and my mom did that in spades. But that also sort of set me on a course to be interested in aging issues. And when I was the director of the rec department, I'll never forget, we set up this really cool program. It was called a high school prom. And so we connected high school students with seniors at the Holiday Park Senior Center, and they did a dance. And there was this woman who came up to me after one of the dances and said, thank you. And I said, for what? She was crying. And she said, that's the first time I've danced since my husband passed away 4 years ago. Mm. And you could see just in that small but so impactful human moment. And I went and I got the student who had danced with her, and I shared the story with that student and said, I just want you to understand the impact that you just had on that lovely woman. And you should feel good about that. And so, we have a responsibility in the county and in government to take care of those who are not in a position to be able to take care for themselves. And we can't rely on the private sector to do that. We can't rely, we have to partner with our nonprofit organizations and to a large degree our faith organizations as well. Because that, in the end, after especially our aging population, has contributed so much to all of us. They've been able to help build this incredible wealth, and I don't just mean that literally in terms of dollars, but when you look at Montgomery County now and compare us to other parts of the country, we often focus on what's wrong here, but my goodness, think about what's right. Look at the fact that a third of our county is made up of our agricultural reserve, that we have this incredible system of parks and libraries and one of the strongest school systems in the country. None of that is by accident. It was done through hard work from folks that have, and we have to pay our respects to them and acknowledge their sacrifices and all they've done by supporting them in their golden years. So I think it's important for the county to continue to have this be an emphasis. And I also think there's some opportunities for us to do some multi-generational programming, intergenerational programming to connect our generations so that we can learn from each other. I love it here. I do. There's so much more to do. There's so much more work to get done. But I really appreciate the partnerships with USG because it just shows me what's possible.
Well, we appreciate being here in Montgomery County. We appreciate your leadership very much, and we're so excited for the partnership and the work ahead together. So thank you so much, Gabe, tonight for joining us. It was a wonderful conversation, and I wish you all the best.
Thank you. Appreciate you.